I'm on the edge of Middlesbrough today, at the heart of Teesside in the northeast of England. Middlesbrough has a long historical association with the production manufacture of iron and steel, but in more recent times it's become the centre of a large petrochemical complex here at Teesport. The town has a population of 140,000, so it's comparable in size to Huddersfield or Oxford or York. Middlesbrough is also the birthplace of James Cook, the great naval explorer who was born here in 1728. Cook went on to circumnavigate the world 3 times, discovering many new lands as he went. And the local hospital here in the town was named after him in recognition of his many achievements. The land that we see behind us here today, of course, in Cook's time was mainly agricultural land. Even at the time of 1800, Middlesbrough was still a tiny collection of houses on the banks of the Tees, with no more than a population of a couple of dozen people. All of that changed dramatically with the coming of the railways in the 1820s. By 1850 the population had grown to 7,000, by 1860 it had increased further to 20,000, and by 1870 it had gone right up to 40,000, so a rapid expansion of population just within 20 years. Many times when we look at national league tables of health and illness, Middlesbrough is ranked often in the worst place in the country, or sometimes in the top 5 or 10% of places with poor health. When we look at a map of premature deaths in England, these are deaths under the age of 75, we find that Middlesbrough, in common with the rest of the northeast and the northwest of England, are in the darkest areas on the map, compared to some of the more southerly parts of the country where the death rates are much lower. The problems with health that we have here in Middlesbrough have been compounded much more recently by the cuts in local authority spending. And what we find is that when we look at the distribution of cuts in local authority funds that affect social care particularly, then the high rates of cuts in local authority spend also coincide with the highest death rates, and that presents a huge challenge for the development of proper care. We also have great contrasts in health and life experience within Middlesbrough. If we take one measure, social deprivation within Middlesbrough, the contrasts are really marked. Up in the area to the northeast of the town centre, deprivation levels are very high in the dark areas, and down towards the south and east of the town, the deprivation is much lower and we have more affluent areas. Nunthorpe is one of the more affluent parts of Middlesbrough. It's a place where we've got large detached executive homes, car ownership, often 2 or 3 cars per household, and average income here is much higher than the rest of the town. We're here now at the top of Ormsby Bank in Middlesbrough. This is the top of a road that runs all the way from here down into the town centre, 4 or 5 miles away. And one of the remarkable things about Ormsby Bank is the huge difference in one measure of public health status, and that's life expectancy, a rough idea of how long people live. From the top of the bank here in Nunthorpe to the bottom, there's a difference in 10 years of life expectancy. Here in Nunthorpe, the average life expectancy is about 84 years. Down at the bottom in Thorntree and Pallister, it's about 74 years. So for every mile we travel towards the town centre, life expectancy reduces by 2 years. This has potential consequences for health and social care. The lower the life expectancy, the greater is the likelihood of population illness, people needing to go and see their general practitioner, and many of those people also being referred to hospital or arriving in hospital as an emergency case. Well, we've now come to the bottom of Ormesby Bank, about 4 miles down the bank, closer to the town centre. The differences in health that we described at the top of the bank occur right across childhood. They start in infancy and extend through the teenage years into adulthood. One of the greatest differences that we find is the rate of childhood injuries and admissions to hospital. For every 100 children injured at the top of the bank attending A&E or going to the GP, almost 170 or more would be injured at the bottom of the bank. When we take another measure of risk in the community, like the achievement at school measured through O-levels at age 16, the number of children who leave school in Nunthorpe with no qualifications is only a third of the number of children who leave school with nothing here. So for every 100 children leaving school in Nunthorpe with nothing, 300 children here have no qualifications at all. This presents a huge risk to their future health and their prospects in life. Here in Thorntree and Pallister, rates of alcohol-related admissions to hospital for illness are about 3 times higher than they are in Nunthorpe. The other general effect on health and disease in this part of Middlesbrough are the higher rates of emergency admissions. For every 100 people admitted as an emergency in Nunthorpe, there will be 200 admitted from this community. One of the things that affects lifestyle in this part of Middlesbrough is the choice that people may or may not have to lead a healthy life. The more that people have to rely on the local corner shop economy, the less likely is their choice in local corner shops where food items may be more restricted and also more costly. And the other thing is that when people have to travel to supermarkets for wider choice and cheaper food, they're having to build in the cost of a taxi. One of the global measures of health in any community is the proportion of people who die before the age of 75 as a measure of how well lives have been lived and how well they've been looked after during life. The proportion of people who die before the age of 75 down here in Thorntree and Pallister is 3 times higher than the proportion in Nunthorpe. Most of the deaths that occur in our community are just from 3 major causes. 30% are for people who die from cancers of various types, 28% from diseases of the circulatory system, heart disease and stroke, and 7% from chest diseases that affect breathing. These 3 major causes of death add up to 2/3 of all deaths. We could do a great deal to postpone or prevent some of these deaths under the age of 75. Some of it's about taking responsibility for our own lives in the lifestyle choices that we make, better eating, moderate drinking and stopping smoking. The other things though that we can do is to make sure that when we have signs and symptoms of early disease that we go and have these checked out by our general practitioner. And of course the hospital and community services have huge responsibility to make sure that screening programs are in place in the community and to make sure that these are accessible for people who are most likely to need them. One of the things we know from Professor Sir Michael Marmot, who has done most work on health inequalities, is that societies that have the fewest inequalities in health have the best overall outcomes. As a consequence of that evidence, what we need to be doing much more frequently is working more collaboratively and much more cooperatively, and we also need to use the best communication that we have to share all of the information and resources that we have. In our local health economy, we need to make sure that the people who work in the National Health Service and in local authorities and in the voluntary sector work as closely and as cooperatively as we can to address some of the challenge that we've seen today on Ormsby Bank.